Welcome back.
We are the Crohn's and Colitis dietitians. I'm Danielle.
I'm Ashley. We're here to make things easier and more fun when it comes to nutrition. And today we're diving into your questions. Today we got a question about medication and can this make your life more functional, give you a better quality of life? And Danielle and I will both dive into, our thoughts on it and also maybe experiences. I definitely can speak from experience that medication can absolutely improve your quality of life and is necessary for many people with IBD and life-saving.
Absolutely. One of those things that I like to remind people of with medication, because some people feel like some people have a whole lot of emotions around medication, but we definitely need to normalize it being a life-saving treatment. And I think hearing that is, maybe it can be heavy, but I don't know. For me, I find it helpful, and it's just a nice thing to hear. If you've watched us for a little while, you have seen that we've interviewed GIs before, and they truly believe that people with IBD shouldn't need to suffer. And a big part of that, not suffering, can be medication. However, one thing I will say, though, is that medication plays a big role in helping to decrease inflammation, but that doesn't always align with decreasing symptoms. It does for some people, but not everyone. So if your inflammation is low and you're still quite symptomatic, there may be some nutrition strategies that we can try out to have more of that improved quality of life.
Yeah. And saying this, as a patient, I definitely struggle with the same feelings about medication, even though I can say, one, I know it's life-saving, two, I'm on it. I definitely still have those same fears that a lot of our patients do, and work through them, every so often. I had been on medication for several years and then had to recently reevaluate and figure out how I feel. Because one thing that can be interesting is when you get to a place where your IBD is in a good spot, it can feel weird to go on, to still be on medication, because it's tempting to want to come off. It's tempting because you feel normal again for the most part. And so you feel like, oh, well, why would I need to be on it? But so I still wrestle with these same things too. And there's so many different things that can impact symptoms too. So I'll give a personal story. One of the things that I'm experiencing right now is I'm at the age bracket where I'm going into perimenopause, and I'm dealing with changes that can impact, I'm not really seeing it from a gut symptom perspective, but I'm seeing it can change your immune system. When your hormones shift like that, just like in pregnancy, we have a lot of patients that get pregnant and their symptoms, they go into remission and they feel so much better. That can happen with autoimmune disease. We talked about it on the podcast with Dr. Yaz. But also when you go into this other shift, which is kind of like the other realm, you can see an increase in symptoms. And for me, it's appearing as psoriasis, basically like scalp psoriasis, having it in my ear. And so even though I've used nutrition to address a lot of gut symptoms, I'm experiencing that. So it's been a learning curve too for me to kind of explore this other realm of nutrition, of how to use nutrition for treating the hormonal changes that we go through.
Yeah, there's a lot to consider when it comes to that. Even, the hormonal changes around your period. There can be ebbs and flows of GI symptoms around that time of the month too. And that I feel is personally, and I think just with talking to people and implementing nutrition strategies around it, it can be super helpful in decreasing symptoms.
I hear what you're saying. It's kind of this other realm of nutrition. I understand nutrition for gut health really well, but I'm still learning. What does nutrition look like when it comes to women's health and when it comes to helping to dial back symptoms from that perspective? And it's a whole nother, this is a new chapter that I'm in, of kind of understanding that and learning as a patient, for one, and hopefully being able to apply some of that to, patients we see. But I do think medication can be life-saving, and it doesn't mean that you can't use your nutrition too. And it also doesn't mean that you failed nutrition. I think we hear that even from even patients have asked us that, or people on Instagram have asked us questions personally about, you know, how do we feel being on medication having failed nutrition, and we haven't failed nutrition. You know, we have it. They can integrate together.
Yeah, yeah. That if you're watching this and see my reactions, I guess it just to hear that question or sorry, that statement, it just kind of like flabbergasts me that anyone would think that they would be a failure for needing medication.
Right.
I
Yeah.
need medication. If I wasn't on medication, I honestly don't know where I would be. I'd
Yeah.
be in a bad place. And
Well,
that's not for failing at nutrition.
yeah. And I think the idea comes from this, maybe people online that are not on it, and kind of this, the polarity on the internet and Instagram is not new. Like we see polarity all the, it's the downside of social media and YouTube and all of that. But I think it comes from, sometimes people see things online that's like, I did this and I'm, you know, med free, and there are things that we don't really know about why that's possible, and you're only seeing a snapshot of that one time with that one person, and it's not the whole collective of IBD. So not saying that they're wrong, but also we have to put it into the context too of like, that's one story, and there will always be things we don't understand fully about IBD that we don't know yet as to why one person can be okay like that. You know, large percentage of others cannot. But yeah, you definitely have to put it into context. And you know, you're not a failure. I certainly don't feel like a failure for being on medication, but it doesn't make it mean that it's not still hard sometimes to accept. You know?
Yeah. I know for me, there was always a fear around medication of, oh my gosh, what's going to happen? What kind of side effects are there going to be? But working through that fear was super helpful in me feeling like a better person. So yeah, moving through the fear and not letting fear control your choice is a big part of it too, I think.
Wow, that's big. Not letting fear dictate your choice.
Yeah,
That's a big lesson for sure.
it is.
If you think about it, yes, there are risks with meds, but yes, there are risks with not being on meds. We need to think about both, and not letting fear. You're right. There's an element of fear can be there, but maybe not be in the driver's seat. Maybe be in the passenger seat.
Yes.
You know, acknowledge that it's there, but still get to where you know you need to go.
To have that improved quality of life, because yeah, that is a possibility with IBD, and that's to have a better quality of life with IBD, to know it doesn't have to be this like doom and gloom.
Yeah, and doom and gloom is a lot. If you're searching it online, I experienced that when I first was diagnosed. It's a lot of that, and you don't hear people that are excited or have had a good experience as much online, you know, telling their story about how much it's impacted their life for the positive.
Yeah.
So keep that in mind. Like, yes, you can have even severe IBD and still have a positive outcome too. It doesn't have to be, and it's okay if it is, and it's all okay, and there is hope, and there, you know, keep going and keep finding the people that you need on your team.
Well said.
All right, until next time.